Good health starts at an early age, and that includes dental care. Joining us to talk a little bit more about back to school time, Dr. Lindsey with Hands Family Dental. Good to have you.
Thank you. Thanks for having me.
Now, what age, now we're all talking back to school for kids, what age do kids have to get dental checkups?
The state of Illinois requires all children going into kindergarten, second grade, and sixth grade to have a dental examination before school starts.
And the parent has to provide proof of that to register.
Absolutely. The state has a form that we have to fill out, and then the parent has to bring that to registration.
Okay, so what kinds of things do you look for in those exams specifically?
It's pretty similar. It's just a standard dental exam. We check for cavities, we check for any soft tissue problems, we check for orthodontic problems, we see if the child's had sealants before, and then we recommend any treatment that might be needed.
And so what do you see, especially in kindergarten, second grade, because you're starting to lose your teeth from that point too? What do you see a lot of?
Absolutely. You know, we just educate the patients about what teeth they're going to be losing. A lot of times we'll put sealants on any permanent teeth that are coming in at that point. And that's the point where we start to look out for orthodontic problems as well.
Some of us that are a little bit older might not be familiar with sealants. So tell us a little bit about that.
What a sealant is it usually goes on the permanent molars. The first set of permanent molars comes in around age 6 and the second set around age 12. The sealant is just a protective covering that goes over the biting surface of the tooth, and it protects those deep pits and grooves on that biting surface from getting bacteria down in them. And in that way it helps prevent cavities.
Wow, okay, so and that's, you may be looking for that in kindergarten, second, sixth grade, but that's something that a parent might choose to do with their child at any age.
Absolutely, yeah, it's always beneficial. Sealants are pretty much pain-free. We don't have to numb, we don't have to drill, so it's much easier and much cheaper to do a sealant on a tooth than to have to do a filling down the road.
When kids get older, so let's talk high school age, what kinds of dental needs do kids have that are different than, say, when they're younger like that?
You know, we're still looking for orthodontic issues at that point, and at that point, older kids, you know, they're getting ready to leave the house to go off to college or be on their own, so we're really stressing having them be responsible for their hygiene, teaching the children proper hygiene because mom and dad aren't around to help supervise them as much. So we're just making sure they have a solid foundation for hygiene so they know how to take care of their own teeth.
And so is it still 2 days or 3 days a week? Or you definitely want to brush more than that, perhaps a day.
Yeah, twice a day brushing, once a day flossing is what we recommend. For some kids that are more cavity prone, we can give them a higher strength fluoride toothpaste that we have here at the office. So it's just kind of dependent on the child and what their conditions are.
So back to school, you guys are doing several things to encourage people to come in,
absolutely,
get their exams. Tell me a little bit about that.
Yeah, we're having our back to school drive right now. If you bring in $10 worth of school supplies, we will give you $25 off of your bill. If you bring in $20, we give you $50 off of your bill. As you can see, we've collected a ton of stuff already. This is over $1,000 worth of school supplies, and we're still going. So.
Which is awesome.
Yeah, it's great.
Yeah, I see Batman down here, some Snow Bear Polar Patrol rulers. Need those to go back to school. So again, it's really simple. Just bring these things in. They get a discount on something they may already need.
Absolutely, yeah.
How often, at the bare minimum, do you recommend to parents, because not everyone gets the dental care at the times that they're supposed to. What do you recommend for parents who are listening and saying, you know, my kid hasn't been in a while? How often do they need to get it?
You know, really twice a year is ideal, especially for young children. You know, they're growing and developing all of the time, so that's the best way for us to keep an eye on everything and make sure that we can catch smaller problems before they become big ones.
Well, and you were telling me that dental troubles are one of the top reasons that kids miss school.
Absolutely, yeah. It's one of the #1 preventable reasons that kids miss school days in the United States.
Yeah, and it's more than just brushing your teeth, which is why you have to come and see Dr. Hans. Dr. Hans, thank you so much.
Thank
we
you.
appreciate it and appreciate all the information and your time, and good luck with this supply drive. How long does it last?
It lasts through the end of next week, I believe, and we are donating all of the supplies. We're dividing them in half and donating them to the Champaign and Urbana school districts.
Excellent.
Okay.
Very cool. You're making a difference for the kids, both inside their mouths for their health and at school. Very cool. Dr. Lindsey with Hands Family Dental. We'll connect you to what's happening here online at CILiving.tv.